Hi, I'm Jeni Broughton, the Principal Tutor here at Base Formulas Training Academy in Melton Mowbray. Today we're going to discuss skin types and specifically characteristics for those skin types to help you to appreciate just how your skin changes and the type of skin that you have. There are four main categories that we talk about when we look at skin. Normal, dry, greasy, which is often called oily, and then combination. So I'm going to take each of them individually. Normal skin. This is a good balance. This has moisture and oil secretion all over it in a nicely balanced way. The skin tends to be soft and supple. Desquamation and cell regeneration takes place at the same rate all through the month, regardless of what's changing, and replacement of the surface layers happens evenly. Pores tend to be small. Colour will be healthy, so there'll be a rosy glow to it. If you think little babies, that tends to be the perfect normal skin. It will also very rarely develop spots and breakout, and what you'll find is it will heal well. Dry skin. Dry skin is often dehydrated rather than dry. It will be flaky, it'll feel tight, you will see fine lines and wrinkles. It will have an uneven texture to it and it can look almost matte. There will be no visible pores because they'll be quite shrunk. And this is basically because there's not enough of the skin's natural sebum to lubricate the surface of the cells and keep them compacted together. So this is why you get the flakiness. There's no covering over the skin, so the skin dries out and flakes and peels. You will often start to get dilated and broken capillaries, so little fine red lines can be seen, and the skin will also appear thin. Oily skin. Oily skin produces more sebum than is needed. This is the skin's natural excretion that protects the body. The surface will appear thick, sometimes shiny, sometimes dull, bit grey looking. The build-up of sebum will actually cause the pores to block and stretch, so you will see open pores and they will be blocked. This is where there is a route for bacteria. This is what causes your spots and your blackheads. There's a thick coating of sebum which will prevent the skin's natural desquamation. This is its shedding process. And therefore the surface of the cells are all sort of stuck down, and this will gather dust and grime, so it can look really quite dirty. It can also be quite dehydrated, so it will need some moisture. So it can be dry and dehydrated as well as being oily. Combination skin. This is by far the most common of the skin types that we see. Main areas that you look for combination are your T-zone, so across the forehead, down the nose. Typically, that is where you would see an oily patch. So the skin across the forehead and nose will appear dull, grimy, greasy, blackheads, spots, and then possibly in the cheeks and around the jawline, that's where you'll start to see dryness, sensitivity, so some redness, some tightening. The next section to this information video is about characteristics that are normal within the facial region. So I'm going to take each area individually and look at some of the more common things that we tend to see in the skin. So this gives you an idea of where your skin's going to go as it gets older and possibly what you should be looking for to keep it fresh and young now. So I'm going to start with the forehead. Sometimes we see deep vertical creases between the eyebrows, the frown lines come in. This is a natural part of ageing. It's prolonged eye strain and stress that causes it. So if you're sat looking at this through your iPad and squinting, that is going to start to give you some of those fine lines and wrinkles. Horizontal creases. This is down to loss of muscle tone. So as we age, we start to see those horizontal lines. Pustules and papules, that's blackheads and spots, whiteheads particularly. This tends to be more in the greasy combination skin types, and this is also characterised by people who wear their fringe forward. Sometimes the hair can cause the blockage by adding extra grease into the forehead. The nose. Okay, broken capillaries, little fine red lines, like little thread veins, but they're not veins, they're the capillaries underneath. This is often caused by friction. If you wear glasses and you're constantly pushing them up, If you have a heavy cold and you've been blowing your nose into that snotty tissue, that can start to give you those little broken capillaries. Exposure to extreme heat and persistent rubbing. So if you've got an itch and you keep going back to it, that can start to cause some broken capillaries. Open pores, blocked pores, spots and blackheads. This tends to be seen in greasier and combination skins. Cleansing and makeup removal will help because you're actually getting rid of the dirt and grime that's already there. So a good deep cleanse will help in that area. Thank you for watching our YouTube video. I do hope that you've enjoyed the information we've given you today. Please share it with all your friends and leave us a comment in the box below, and if there's anything you'd like to see, add that to it. Don't forget, check out the other videos that we have on our YouTube channel, and of course our website for any products that relate to what we've talked about. Thank you for watching.